Welcome to This Week in Health IT News, where we look at the news which is going to impact health IT. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. Before we get going, I want to give you 3 resources that health IT can use during this crisis. The first is for CIOs. I'm currently helping my coaching client CIOs as a sounding board and advisor through this time. If you would like to connect with me over the next 2 months and experience coaching at no cost, shoot me a note at bill@healthlyrics.com. For anyone in health IT who finds themselves in uncharted territory or want to crowdsource solutions with a team of seasoned professionals, we have set up 2 ways that you can do that. The first, we now have a Slack channel that is monitored and supported by our sponsors, and I am so excited that our sponsors have stepped up to do this. They're each providing people to monitor this Slack channel and to offer their expertise, as well as it's a platform for health systems to interact with each other to hopefully crowdsource best practices and those kind of things. So special thanks to our sponsors, VMware, Galen Healthcare, Sirius Healthcare, Starbridge Advisors, ProTalent Advisors, and HealthLyrics, which is me. The Slack channel allows you to get your questions answered, whatever they are, telehealth, VDI, EHR, scaling up your EHR platform or whatever needs to happen. If you want to access it, send a note to Slack, SLACK, at thisweekinhealthit.com, and we will get you set up immediately. Now, we understand also that some of you are not excited about Slack, but you still want to be a part of getting some of this crowdsourced support, and we offer another channel. It's an email channel. You can send an email to support@thisweekinhealthit.com. If you just want to shoot the email over, we will route it to the appropriate parties, and they will get in touch with you and start to collaborate with you on potential solutions. And once again, I just want to thank our sponsors for stepping into that gap, and helping us to provide that service to our listeners and to the industry. All right, let's get to the news. As always, I'm going to focus on health IT. There's a ton of things that I could talk about, but we are going to stay true to the show and focus on health IT. First story is from Chrissy Farr. It's a story about telemedicine. So telemedicine companies struggling to meet coronavirus demand. If you haven't seen it, Chrissy Farr, who does a lot of reporting in the health IT space, she also shared a story of her wedding. She had been planning a wedding up for a year. It happened during this time frame, and she canceled the wedding, and they're going to do the wedding at another time. Great story. I'm glad she shared it. And if you get a chance to look it up, it's worth reading. Getting back to telemedicine companies struggling to meet the coronavirus demand, there's really 3 main points that comes out of this. First, telemedicine companies are seeing unprecedented volumes of patients trying to use their services. Absolutely what we expect to happen. Hospitals and health insurers are encouraging patients with suspected coronavirus symptoms to try virtual services first rather than coming into the doctor where they might infect others. Absolutely true. And just in my conversations today with health system CIOs, they are seeing a significant increase in telehealth visits, and it's pretty staggering, the numbers I'm hearing. Some of these companies, she goes on to say, some of these companies say that their IT is breaking down. Others are frantically hiring hundreds of doctors to meet the demand. All right, so here's what we usually do on the show. I usually give you my take on this. This is absolutely to be anticipated. The networks were not designed really for this. You're going to have failures. You have a lot of moving parts. We are moving things very rapidly right now. Even if you have a core telehealth solution, you should have a backup to that solution. And I think one of the things that happens in health IT and healthcare in general is we strive for perfection. And for good reason. We provide care for people in their moments of need. So we have to provide solutions that are tried, true, and tested. But this is a special case. We are in a crisis mode. And normally we would have to, put together solutions that are highly integrated and work across the board. That's not the case we're currently in. People are looking for solutions. You have physician practices. You have primary care physicians who are now doing televisits. They haven't done them before, and they can't wait for perfect. They need something in place now. So what I'm going to run through is sort of a path that you could utilize. So the first thing, so telehealth has 3 main components: teleconsult, telemonitoring, and televisit. Okay, consult is physician to physician. Your system may need that at this point. It really depends on what's going on in your community, but consult physician to physician. Telemonitoring, monitoring people remotely, this is an important solution. It may become an important solution during this crisis, but again, you're going to have to determine that based on what's going on in your market. And the last is televisit. This is what we're finding to be the primary need right now. So I still think you should determine what is the most critical for your system. I'm going to assume it's televisit at this point because that's what I'm hearing. One of the things I'm telling people in this crisis moment is don't implement new unless you have to. Okay, so there's a lot of moving parts, a lot of things happening. It's a heavy lift to do telehealth and to do it well. You're going to want to spend more time training people and building templates and adjusting workflow because all those things are really required to do televisits and to do them well. I've spoken to health systems just this week that are using FaceTime, and I really applaud that. The HIPAA restrictions have been relaxed. We shouldn't be thinking, oh, is this our long-term solution? We should be thinking, what do we need to do right now at this moment in time? And with the HIPAA restrictions relaxed, we have an opportunity to utilize some systems that we normally wouldn't, but they are appropriate right now. Don't get caught in the integration trap is the last thing I'm going to really focus in on here before I go through the system. Televisit is really a queuing system. That is a waiting room, an education platform. How are you going to educate people while they wait for that call? Video conference solution, and I'm going to really focus in on anything we'll really do that works, and a documentation platform. If you're going to try to integrate the EHR during the pandemic, likely the pandemic will be over before you're even close to being done with that type of solution. All right, so what do you stand up? I've seen a lot of people really focusing in on the technology, and I think, again, you're not trying for perfect here. Stand up something quickly that your physicians can utilize. So the first thing you need to do is you need a screen that can really handle two applications going at the same time. You're going to want one for the video conferencing solution, and you're going to want one for the EHR, okay? And if you do that, you've just solved the documentation and billing problem because while they're seeing the patient over here, they can be documenting as they normally would for a visit. I'd spend more time on the templates and the training and, just consider the fact that you're likely ramping up, the numbers I'm hearing, likely ramping up for almost a 10-fold increase in your televisits. The next thing, queuing system. I would say do return phone calls, do return video calls, instead of trying to stand up some complicated queuing mechanism, electronic queuing mechanism. Have them call in, get their place in line, and then you can call and instantiate the video conference in that direction. You can use the admin staff for this. There's a lot of displaced admin staff right now because, quite frankly, because our waiting rooms are empty. We're not doing, voluntary surgeries and other things. So there is some staff that can be put to use for this, and they can help queue people up. It's low tech for sure, but it works. The next thing is education. Your education platform today should be pretty much your website. Okay, this is how I'm thinking about it. You want to be communicating with the community not only for your telehealth platform, but for just general communication with them. I would look at a handful of organizations that have done this well. Baptist Health has done this well. Intermountain has done this well. Mayo has a great FAQ. Multicare is a good example of the homepage. There's chatbots and other things. In fact, that's probably the next thing I'm going to say. If you can take people away from even the televisits and get them into the chatbot workflow, that would be great. CDC has a self-checker bot that you could utilize. There's a free COVID-19 chatbot available from Orbita, and Charles Boise with ClearSense also shared with me a company called Hyro, Hyro, has a COVID-19 assistant and self-assessment tool. There's a lot of things here that are available to you for free that you could utilize on your website for education and for routing of people. And finally, people are spending too much time worrying about the video conference solution. Look, Zoom, WebEx, Skype, FaceTime. These are all appropriate for clinical uses right now. Okay, in this moment, they're appropriate. We have people going out there and trying to find the perfect video solution with integration into your EHR. Don't get caught in pursuing perfect. Stand something up. So that's my take on that. Probably a little longer than I wanted to, but I did want to cover that because telehealth seems to be something that keeps coming up. The next thing is, some great frontline reports from his talk, and I'm going to share a couple of these with you. Large Midwest health system with medical school. Continuity of command structure. Statistics show that as much as 30% absent rates could be realized. We have been asked to document our command structure at least 3 levels deep. We've talked about this with several people on the podcast earlier, and it's important, especially if you're a clinician who is in an IT role. We're seeing a lot of those people be reallocated, redeployed in different places within the health system, and being able to know who you're going to hand the baton to do certain things, and preparing those people for the ability to step up is really important. Boston-based health system, and this is an interesting. So a patient does not exist in Epic until they have a visit or a bed. This has been one of the problems with EHRs, not just Epic, but EHRs in general. EHRs are great for tracking patients, but that's not all we have in our community. We have consumers of health. We have just the whole population to track, and this is why we overlay things with things like Salesforce. And I would like to see this really change sometime soon. The ability to have Epic or the EHRs, especially in these kinds of situations, track more than just patients. Anyway, with that being said, with new tents being added, lobbies being bedded, and new ICU beds being planned, Epic builders and managers, physicians, and leadership are working overtime to get it all built. And they talk about how the command structure has been set up for nearly 2 weeks, and they're doing Herculean tasks. And they go on to say, I'm not sure anyone outside of Epic would understand how much work this takes. It absolutely takes a ton of work. It's amazing what Health IT is doing. I was saying to somebody today that I think what Health IT has been able to do over the last, 30 days is probably comparable to the amount of work that we've done in the past year. We don't normally move at this pace. It's amazing what we've been able to do with Focus. Focus is an amazingly powerful tool when everybody in the organization knows, hey, this is the most important thing that's going on right now, and these are the things we need to stand up, and Health IT is rising to the challenge. It's just fantastic. Small rural health system in the Pacific Northwest. Okay, so this is the heart of where things are ratcheting up, Pacific Northwest and New York City, so this is a small rural health system. One of the things I appreciate about these people is they don't have a huge staff, so they have to stay focused. So here's what this one talks about. Agility matters. Stay hyper-informed about what is going on locally and nationally. Literally try to guess what is going to happen next and keep planning for worst-case scenarios, which so far have been proven to be the case every time. Keep it simple. A quickly deployed 60 to 70% solution is better than nothing at all. Suboptimal is the new normal. Focus on telehealth. True. Expect and plan for big support overhead with telehealth and work from home from all levels of IT. That's true. Expect all your technology partners to be fairly overwhelmed. That is true in some areas. To be honest with you, there are some underutilized organizations. So, reach out, see what you can find. Stay engaged with your clinical and operational leadership. Absolutely, you should be in lockstep at this point. And dust off your disaster plans and business continuity plans. I would say on that one, the reality is you should know what they are. If you didn't plan for certain things, if there's gaps, you're probably finding them right now. If they're critical, fill them. If they're not, what you're doing right now, looking at those plans, is really planning for the next major business continuity challenge. North Carolina health system spanning urban and rural areas, big investment in telehealth capability, network upgrades, training investments are all paying off. And that's really true. There's some health systems that have made those investments and done the right things, and it's paying off right now. I did get this email from a Northeast health system. We have literally going nonstop, working with Epic modifying our systems, rapidly adding televisit capacity, both Epic Video and Teledoc. Again, primary and backup, adding drive-through sites, modifying the lab system, etc. There is a morning meeting just to track the COVID-19 related IT projects, and leadership has a minimum of 2 calls per day. Everything is being put on the website for communication, which is great. We started with 25% remote work 2 weeks ago, and with no in-person meetings allowed, the technology team scaled up after adding to the capacity. We are now at 100% remote in all areas that can. We do daily and twice daily scrums with teams. Zoom is being stretched. And they're augmenting their support center as well. Contingency planning is in process for our upcoming go lives, and they also talk about how they think this is going to change everything moving forward. That is probably true. I just wanted to share some stories from the front lines. What's going on? What I found is we're really falling into 2 camps. We're falling into camps that are busy beyond their belief. There's just so much going on. And then there's camps that are waiting for the surge to really to come to fruition, and they are planning for the worst and putting all that prep work in. But for the most part, they are not nearly as busy as what's going on in, say, Pacific Northwest or New York, or really the Northeast corridor right now. The 2 most common problems: PPE. It's hard to care for people when you can't protect yourself. Continues to be a problem. And testing. The testing's all over the board. It sounds like people are waiting 7 to 10 days potentially for the tests to come back. That's really not working for the health systems. We have some health systems with the wherewithal. The academic medical centers are coming up with their own tests. We heard that in the podcast from Stanford. I heard that from another academic medical center just 2 days ago. So we're seeing that work being done as well. So let's see. Another story, a great story just came out, how EHR vendors are arming providers to handle COVID-19. Again, I put all these links on the COVID-19 resources page on This Week in Health IT. You can check them out there. Allscripts is virtually, a lot of them are focusing in on updating updating the workflow, updating the capture, updating to CDC best practices around order sets, social history questions, and the like. Allscripts, virtual history. Follow My Health is also doing patient to provider telehealth. This is important. Athena Health, again, order sets and those kind of things, virtual care. Cerner, also additional screens and monitoring. They just did an update to Millennium around COVID-19, telehealth again as well. eClinical Works, focused on virtual care. Meditech has offered their Expanse ambulatory and patient portal use complimentary deployment of their scheduled virtual visits functionality for a 6-month time frame. Be looking at that. A lot of organizations are offering discounted licenses and services right now, so have those conversations. And finally, Epic. And as you would imagine, with their market share and their breadth, they're doing a fair amount. The company is encouraging organizations to share COVID-19 information through Epic's interoperability network, through Care Everywhere. Also for non-Epic organizations, they're sharing through their interoperability network as well. Similarly, Epic has advised provider customers that its MyChart portal can be used to handle questions, complete screening, and communicate through e-visits, video visits, and secure messaging. Which is fantastic in this time. Several weeks ago, Epic issued an update to its travel screen criteria to identify patients who had traveled to affected regions. While travel restrictions mitigate these concerns, Epic says they will continue to update these criteria. Using analytics with Epic's suite of products, clinicians can create and run reports to hopefully pinpoint hotspots using COVID-19s by zip code, patients by zip code to discover potential hotspots. So that's what the EHR providers are doing. I wanted to share that. That is really good work that they're doing. They're supporting the industry at this point. If you want to get to those links, go ahead and hit our resource page. Find the EHR provider that you're looking for. Click on that. It'll take you to their page. Finally, I want to talk a little bit about what big tech is doing right now. So, interestingly enough, Apple updated Siri to help people who ask if they have coronavirus. You can test this out right now on your phone. I don't want to do it because I'm recording this on my phone. But if Siri is asked, do I have coronavirus, it will respond to you. So that is a great update. Love to see what they're doing. I love that work that they're doing. Google's coronavirus search hub makes COVID-19 information easier to find. This has been much talked about, but since literally billions of searches a year start with Dr. Google, it is important for them to have the right tools available for the people as they're searching. I played around a little bit with this. It is a really good tool and very informative. I like it a lot. Also, CDC uses Microsoft's healthcare chatbot symptom checker. Man, say that 10 times fast. The chatbot runs on Azure, and the CDC owns and maintains the tool and does not share any personal information. Users enter into the bot with Microsoft. Versions of the chatbot are already online in 9 health systems, says the Wall Street Journal. Let's see, healthcare provider Providence launched a limited version of the bot on March 5th, opening it to all users on March 8th, according to the Wall Street Journal, and says that the bot has had more than 40,000 sessions and more than 6,000 handoffs to video consultations so far. So again, fantastic work happening on top of Microsoft's platform. Heck, even Elon Musk is getting into the works. Musk, he talked ventilators with Medtronic, and as they were doubling their production, and then he also went out and sourced a whole bunch of material from China, which he and his team orchestrated the acquisition of and brought it into LA, and they are now distributing that information. So that's that equipment, which is fantastic. So big tech is stepping up and doing a lot of stuff at this time, and it is greatly appreciated. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, you can check out our website, thisweekhealth.com, or the YouTube channel. If you want to support the show, the best way to do that is to share it with a peer. Just however you do that, shoot them an email, shoot them a note, do it on social media. However you do it, go ahead and do that. We'll be back again tomorrow with another episode, and we'll just keep dropping them as we line up interviews, and we have a bunch of interviews lined up right now. We are going to start, we now have a known problem set, and we're going to start focusing on solutions. So I'm going to be talking to people about scaling up your EHR environment, scaling up your VDI environment. I'm going to talk to a Citrix expert around what they're doing. And then I have some interesting different kinds of podcasts coming up. I'm talking to a former CFO of a major health system. We're going to talk about the financial aspects of this. Not that we don't appreciate the crisis that's going on, but there are a lot of money being spent right now and not a lot of money coming in. I think that's going to create a problem, and I want to talk to somebody who is adept at this, who can help us to understand it. We're going to talk mental health with a former guest of the show, and talk about what people are doing around that. And I think that's going to be a very good topic. And then we talk leadership in crisis also. So these are all episodes that I've either already recorded and I'm just in the production phase. So we're going to just keep dropping them every day. As long as you guys find value and you're downloading them and listening to them, we'll keep putting them out there. So thanks for listening. That's all for now.